Welcome everyone to this session, the Health and Human Services Special Interest Group meeting. My name is Esri Garrity and I serve as the Chief Medical Officer at Esri. And I have to tell you that I am pretty excited and honored to be joined by a highly esteemed panel of experts today. Let me introduce them. We have Dr. Ron Jarman, Acting Director of the U.S. Census Bureau, Mr. Dan Gall, the Deputy Chief Strategy Officer in the U.S. Department of Veterans Affairs, Veterans Health Administration. Dr. Samira Asma is the Assistant Director General for Data, Analysis, and Delivery for Impact at the World Health Organization. And Mr. Rob Shankman is the Chief Geospatial Information Officer and Geospatial Integration, Analysis, and Visualization Branch Chief at the Department of Health and Human Services, Office of the Assistant Secretary for Preparedness and Response. Thank you all for joining us today. Very happy to have you here. So we're going to definitely encourage you guys to participate, the audience, and ask your questions of these experts after we get through a few questions of my own. And so we're using Slido for that purpose. I hope you've experienced that in other sessions. You should get a notification. We are at hashtag EsriFed1225. So let me tell you about this panel. This panel discussion is really going to be about how COVID-19 has accelerated digital transformation and innovation across governments. In a year where we've had major disruptions in our lives, we have seen the politicization of health, and we've heard almost nothing but bad news. This discussion is going to shine a light on the incredible advances that have taken place, the strategy and the vision of this amazing group of leaders, and it's going to provide a glimpse into the future for achieving better policy, equity, and connected decision-making going forward. But to get there, we really need to start at the beginning. So my first question is going to be for all of the panelists, but I'd like to start with Dr. Jarman. So it's clear that the pandemic caused virtually every organization to adapt their approaches, their workflows and systems in order to accomplish their missions during COVID-19. Can you talk a little bit about the transformations you led your organization through and the role that GIS played? And you're on mute. Always
we have to have the obligatory unmute thing. So thanks, Esty. I think you couldn't have timed the pandemic in a worse way for the operations of the Census Bureau. So if you recall, Census Day is on April 1st of the 0 year, according to the law. And so we were just beginning what we call the self-response phase of the census back last March, when we got the news that like the rest of the country, we were moving to telework. We were closing some of our 250 offices that were just ramping up to do the non-response follow-up operation for the census, and so we had this huge national disruption in the operation of the biggest thing that we do every decade, the decennial census. And so I think it was incumbent on us to quickly sort of figure out how we were going to replan that huge operation. And so what we did was we just pushed it into the future a bit. So hoping that the pandemic would sort of tamp down a little bit over the summer. And I think it did. But what happened was we moved the census then into the heart of hurricane and wildfire season. And so we were not only trying to, sort of synthesize all this information, like from Rob's group, you were downloading information on the pandemic, to help us plan our field operations for the census. But then we were suddenly confronted with having to, snake around hurricanes, we had huge wildfire issues out in the West. And so GIS played a huge role in helping us sort of manage that, not just from a strategy perspective of moving the whole operation, but on a day-to-day sort of game time decision. Are we going to send folks out in Northwest Louisiana with the weather coming in, or is the smoke too bad in California or Oregon? So, having sort of this real granular geospatial information and the tools to synthesize it and make sense of it was, hugely important for our effort.
Thank you. I hadn't thought before about the spatial and temporal aspects of the timing of the census. So just that opening remark really opened my eyes to something new. I'm going to ask the same question, like I said, of all panelists, but I'm moving to you next, Dan. What were the transformations that you led VHA through, and what role did GIS play?
Well, thanks, Esty. Well, the VHA is the nation's leader and the largest integrated healthcare system in the United States. So where it really helped is it has 4 missions, healthcare being one, but people often don't think about the other 3 missions until this past year. We have health education training as a mission, research, but mission emergency management came into prominence. And where GIS led it for us is really understanding, communicating, collaborating all the data as it quickly came in. We were just coming out of implementation of the Mission Act. So with that, we had already leveraged GIS to look at drive times from the facilities. So GIS was being implemented into it. But as the data came in, we started gravitating more to that map-based dashboards and open data sharing. So really, as it came in, we were looking at the patterns of prevalence happening across the US, both at the facility level and then also within each state, and then at the enterprise level and across. And we're looking at the typical things, the bed status, the supply status, and then using those real-time information to determine where the resources should be put. And out of that came our National Surveillance Dashboard, very similar to the Johns Hopkins University. And what we really needed was to centralize and get an authoritative source for all this rapidly emerging information. And the National Surveillance Dashboard became our authoritative source to look at the cases, the mortality, the testing, and now the patterns of the vaccination happening. And also taking a look at incorporating some of the health equities into that dashboard too. So not only do we look at it from the patient category perspective, the employee perspective, but also now we've got the race and ethnicity breakdown that goes from the ability to look at it from the facility level all the way up to the VA level.
I think that's great, and shining that light on a system that is able to be so comprehensive and yet really focus in on the disaggregated data so that we can make sense of it and start to do better with what has become magnified as health disparities through this pandemic. Dr. Asma, you have kind of a different role, not national government, but supporting governments around the world at WHO. What kinds of transformations have you been leading WHO through, and what is the role that GIS has played?
First of all, thank you, Esty, and thanks, Ron and Dan, for those insights, and also for inviting WHO and the opportunity to share with you the work that we are doing. We very much appreciate our longstanding partnership with Esri. I would like to begin with that and commend the work that you've been doing. Your contributions are truly saving lives. I would like to begin by saying that COVID has caused huge losses and tremendous personal tragedies. Just today, we have reached about 2,475,000 deaths. The pandemic is more than just a health crisis, and a stark reminder that we are all very much connected. And then when Dr. Tedros took office, we embarked already on an ambitious transformation agenda to make WHO more accountable, more impact-driven, and more people-centered. The point I'm making here is that the transformation journey began even before COVID, and we recognize the need to focus on technology and partnerships to meet the global goals. And our transformation strategy is indeed data-driven and focuses on delivering impact with clear metrics based on SDGs. It's a challenge. It's not easy because there is a varied level of capacity in countries, and the influx of data and the data dissemination has been varied. But also that the pandemic has also threatened the years of progress that we have made already. And more importantly, it has also uncovered the very deep structural inequalities. So WHO is indeed committed to work with partners like Esri to scale the technologies, address the data gaps, and accelerate the progress to get back a better, stronger. For example, I would like to highlight that ArcGIS as an online data collection platform to improve the surveillance systems and the information that we are gathering on the number of cases and number of death counts that countries are submitting to WHO is really indeed supporting the timely, reliable, and actionable data. And as we look forward with the vaccine rollout, as was said earlier, GIS becomes extremely important to reach even the remotest communities and close the gaps and address the inequalities. And hopefully we will be able to get there.
I'm sure we can. I have complete faith in all of these organizations. And you said something that I think really rung true among many things, but the one that caught my ear was that the transformation started before COVID. And I think that, that's really a good segue to Rob commenting on this question, because I always think, Rob, of, you're so used to dealing with emergencies. And when you think about this particular crisis and the transformation that you guys have already been going through, how do you respond to this transformation that you were leading through and the role that GIS played? Was it different from what you've been doing?
Yeah, so thank you, Esty. This is different than what we've been doing throughout the past, I'm going to say, decade and a half that I've been there at HHS. We've been normally dealing with natural and man-made disasters, but they've been very short-lived, and they've been very predictable for the most part. We know when hurricane season is, we know when fire season is, we know when there's a special event, which is generally the impetus potentially to a man-made event. So we know these things. We can really plan for them. We can even pre-stage data connections. We can pre-configure dashboards and connections with other federal agencies. So we know this, and so the transformation for us for going from what we know to what we didn't know was difficult in the fact that we didn't even know when and where this data existed, if it even existed, and then finding the data. If we find out it exists, to find out the actual authoritative source, not just a source, but the authoritative source. And for federal governments, that makes it a little bit more difficult because we can't just go grab a commercial off the shelf source. We really need something a little more authoritative. And to take all of that, aggregate it, and then coordinate with all of the other federal agencies to get that information back to the Census Bureau, back to the VAs, back to everybody else, so that they can start to make their decisions on that authoritative data. And that's what we've been doing. So it wasn't necessarily a shift in our mission scope in terms of what we do. It was a shift in the data acquisition and the data aggregation that we've never had to do before from sources that we normally don't get to have the visibility to. Individual hospitals do not report on a daily basis to HHS. That was not the norm. That is the norm now. Shipping does not normally go through us. I mean, that's all transportation and economics. That has nothing to do with HHS. Oh, it does now when you're talking about shipping vaccine. So there are all kinds of new information that we're now getting connected to that does change our thought process and our data dissemination process.
I think that's fascinating. It really goes to the point that in a crisis, everything's magnified. We talk a lot about how disparities are magnified, but I think the other thing that is really clear is we are so interconnected. And I've made the argument many times, and people have heard me say this, that everything is related to health. And I feel like this year has proved me right. So anyway, that's beside the point. So let's move on to question 2. It said that necessity is the mother of invention. So what innovations that you were forced to adopt in the last year do you think will persist when we return to normal, whenever or whatever that might be? And has the pandemic accelerated your ability to experiment and to prototype on the fly? And I'd like to turn to Dr. Asma to start us off on this question.
One of the biggest lessons I think we've learned from COVID is that we need a common global health weather bell. Consistently since the start of the pandemic, we have observed the media headlines across the world reporting on our inability to capture the true impact of the pandemic, whether it is the deaths, knowing the accurate number, we still know that what we are reporting is an underreporting because we really have not really grappled with the extent of the pandemic. But as the earlier speaker mentioned, and you mentioned, that we are also interconnected, the transportation, whether it is airways or whether it is on the ground when we talk about vaccine delivery. We are a few blocks away from the World Meteorological Organization here, and they were established in 1945, and they share satellite information as an open source, and therefore we are able to forecast on the inclement weather. And I think that is one of the most important lessons we have learned, that information is at the crux, I think, if we want to be better prepared. And also I want to say that when Dr. Tedros began his leadership of WHO, he really aspired that WHO to become a more innovative, modern, data-driven organization. So we have just launched developing a state-of-the-art World Health Data Hub. And this has been in partnership with many technology partners such as Esri, Microsoft, Facebook, Twitter. As you already know, that many of these partners has helped us with infodemics and countering misinformation. So the idea of the World Health Data Hub is truly to work with all the partners in this space and make data available in a way that is real time and accessible. Of course, at the same time, ensuring that we preserve the privacy of the individuals, and that is underpinned by having common data governance standards of what data to share, when to share, and how to share. And hopefully, as we evaluate the way we have operated, all of us, during the course of the pandemic, and what the lessons have been learned, clearly will help us establish that. But more importantly, the data is generated on the ground in countries. And what we really need to now come together is how we provide the support that is needed for countries to rapidly strengthen the capacity to have the data, not only to inform the global community, but also to use the data to improve performance at the same time.
I think that's great. And I can imagine that there are hundreds of people now Googling World Health Data Hub as something that they're going to want to bookmark and use frequently going forward. I just think that's huge news. So this same question is going to be for all of our panelists. So Dan, I'm asking you next about the innovations that you were forced to adopt And do you think that they'll persist in our new normal? And talking a little bit about experimentation and prototyping.
Sure, thanks, Esty. Yeah, one of our key innovations was actually strategic and organizational design. So we used to be the Office of Policy and Planning embedded within the operational staff. And during this pandemic, we actually restructured and became a chief strategy office, which elevated us from 2 levels down from the senior leadership, reporting directly to our deputy undersecretary and undersecretary. And that was key because our mission now as the Chief Strategy Office is to integrate strategy, information, and insight to enable the VHA to provide that industry-leading healthcare. And within our office, we have the newly branded Geospatial Service Support Center. So that's the single authoritative source for all GIS within the Veterans Health Administration. So this elevation brought up GIS to a different level with integration. And one of the things that we learned from this was part of that integration is there's so much information coming, so many program offices, so many initiatives as people are trying to figure out what was happening during this pandemic at the operational and tactical level. There's a lot of planning, so they grouped these and brought all these planners together, and then we took the lead to start integrating all that information coming up. And a lot of that was coming up that dealt with the geospatial, especially with the bed expansion capabilities, looking at our mental health and state veterans homes. The telehealth was big, our Veterans Experience Office. And then a shout out at the time was our Office of Rural Health that was looking at how you can increase the access out in the rural areas. And we used our geospatial analysis to work with these program offices using the drive time analysis that I talked before, but incorporating what we were learning from these program offices, such as health equity, incorporating social vulnerability into our analysis into the spatial realm. And then we got into scenario analysis because we had to have scenarios. And that's led to one of our other ones in the planning is our market analysis. We've just coming out of a 3-year process of looking at our markets. And now we're looking at a lot of the tools we used into looking at the 96 markets that are across the United States, the migration of enrollment, all those tools were used to help the scenarios with this pandemic. So we're looking forward to working closely, assisting all those program offices and carrying on past the pandemic.
I think it's, I've told you before that I'm amazed with the breadth of the work that you guys are doing. And I certainly hope that other hospitals and health systems are hearing this as a vision for the different ways that GIS can support the operations and workings and distribution of healthcare services among their populations. So thank you for that answer. I'm going to turn to Rob for the same question. Again, it was about the innovations that will persist in our new normal. And again, the experiment, what have you experimented with as you've gone through this year?
So thank you. So yeah, so the innovations for this year and experimentation for this year have been enormous, I'll say. So we're used to getting new sources. We're used to getting, a few new things for, say, when there's a hurricane in Florida, we'll get connected to the Florida Department of Health and we'll just pull in, that one state's piece of information. The new things that we had to do were connect to new national data sets. They're larger, they're definitely more intricate, and the data pulls and the analysis takes a lot more time, especially when we have to do this on multiple times a day. So most of this data was coming in 2 and 3 times a day. So we're talking about having an analyst run it. So some of the things we had to learn how to do were automate all of this. We had to automate the data pulls. We had to automate the analysis. I mean, this was going on 7 days a week, 24 hours a day, starting, pretty much in February of last year. So we're past the 1 year mark and moving forward. And so having scripts written that will automate the data, that will automate the data feeds, that will automate the dashboards for databases that we've never seen, we've never had connectivity to. We had to do that rapidly, and that's something that we've been doing, but just not on that scale, just not with that amount of data. And so that's forced us to figure out, how do we develop quicker? How do we write code that can be reused in modules so that we're not writing one whole set of code to ingest one data set and then another completely start from scratch new set of code for this next database. We're starting to write our code modularly, that we can actually pull code pieces out and share them and reuse them. And then we've had to learn how to collaborate and make adjustments, both from our side and our users, and our data providers have had to make adjustments. We had instances where the data was coming in and it was great for us, but some of the users didn't have the ability to do what they needed to do for analysis. And we're only the middleman, but we were the middleman. So, it became incumbent upon us to then go back to the data provider, go back to that person who's actually doing the data capture and the initial data production, and ask them, how do we get our client on the downstream side to get what they need from you as the data provider? And generally that wasn't done, because we would be connecting to mature data systems that were already in place. These are data systems that were never in place. They were being created on the fly for this particular event. Not to say they won't be carried through further for additional tracking, but no one had seen this type of data at this scale for this period of time ever before. And so asking those data providers to continually adjust what they're providing to us was something we hadn't done. So that was a huge step for us for innovation and collaboration. And so we've been doing that. We've been doing things faster and more agile than we have before. Obviously, the Esri software makes it possible to do that, but our staff was also, extremely capable of doing that. And so we moved forward, and I won't say that we didn't skip a beat, but we certainly made everybody's job easier by being able to provide them the data that they needed in the timeliness that they needed it.
I think this is exactly what people need to hear when they doubt that government can be agile and can move and pull in new data sets, automate processes, work with bigger data sets than ever before, have real-time results. I mean, I think all of that is really inspiring and builds confidence, not only in government, but that other organizations could do it too, that they would have the resources to, and the wherewithal to even believe that they could achieve this level of automation over such a short period of time. So Dr. Jarman, I leave it to you to give the final words on this last question that I have for everybody, and then I'm going to move into individual questions.
So thanks, Esty. So, when the pandemic happened, we just had a flood of people coming to us with questions about sort of our primary mission, which is, to measure the people and the economy of the country. And so you have a situation where the economy's shutting down, people needed real-time information. And so, sort of existing data assets that we have, we're just up to the task. I mean, they didn't have the frequency that I think data users needed to track how the pandemic was sort of impacting households and businesses, especially small businesses, which are kind of, more of a hidden aspect of the economy relative to your larger companies that are surveyed all the time. So we collaborated with a bunch of agencies around town, including HHS, including the Federal Reserve Board, Small Business Administration, so on, to quickly stand up two innovative surveys, the Household Pulse Survey and the Small Business Pulse Survey, all online. The Household Pulse Survey uses text messaging to reach out to people, to provide weekly data on how the pandemic was impacting Americans and American businesses. And so I think one of the clever things about that effort is it is very nimble, and very responsive. And so not only did we stand this up within, a couple months of the pandemic first sort of becoming known, but we've also changed the content of those surveys over the course of the pandemic to sort of mirror the what's happening to households and businesses. And so once vaccines came online, we started asking questions about whether people's intent to be vaccinated, that sort of stuff, which has been hugely valuable in a number of discussions about strategies around getting shots in arms and that sort of thing. But the other thing was, we stood up on a Esri platform, a COVID data hub, that tried to synthesize as much of especially the geographically, tagged information on both health and economic variables and that sort of stuff. And so just put it all in one place. It's, to make it easier, like Rob said, to make it easier for data users to go out there and gather the information they need to understand things. But I think there was a number of things that we did to try to speed up. We had some quarterly estimates that we turned into weekly estimates, just things for people to understand how this was impacting, households and businesses. And some of the things we learned some very curious things. So, just a kind of a sidebar here. After the last recession, we saw a huge decrease in sort of entrepreneurial activity of people starting new businesses. But there's something about the COVID related recession that we've seen people actually increasing entrepreneurial activity in a few sectors, especially. So just some interesting things to chew on from both a sort of a research and policymaking perspective about how different shocks to the economy have different impacts and stuff like that. So I think this is different than other things. And, interesting work will be done after this is over to sort of go back and unpack some of those things and maybe to come up with, policy levers that can better address things the next time something like this happens. So.
Absolutely. And to everybody, that's said by some of the best surveyors in the world. And also, if anybody hasn't seen the US Census COVID Hub, I recommend taking a look. There's a lot of great data and information there, really worth your time. So now I'm going to transition. We've built some questions that are really focused on the talents of the individuals on this panel. So I'm going to start, Dr. Asma, with you. WHO supports all member states, some of whom are certainly resource constrained. How does WHO help these member states with implementing and modernizing their health information systems? And how is GIS helping all countries participate in the global health information systems?
Very good question. I would like to begin by saying that COVID has really shown that even the most developed countries, supposedly which have good health information systems, are not able to report accurately on something as a cause of death caused by COVID or underlying causes. And to take it a little further, data disaggregation by age, sex, and or location. So there are across our member states a variability in the capacity of data and health information systems. One of the important finding is that about only 40% of the world's deaths are unregistered. And this drops to about 90% in African region. So when we juxtapose it with COVID-19 and to account for the impact of the pandemic, it becomes really difficult. And just last year, about 124 countries lacked national time series data on all-cause death. Another statistics is that the World Bank estimated that there are 1 billion people that are invisible because they don't have birth certificates, birth registration, or death certificates, let alone causes of death. So the question is, how do we prevent if we don't know what causes premature deaths? And also, how do we channel the resources? So with this backdrop, what WHO has been working towards is, I mentioned about the World Health Data Hub, which will also house a GIS Public Health Service Center that will provide support to all the member states using geospatial information for various elements of health information system. Last year, we launched a technical package called Score for Health Data Technical Package. It's a resource of about 90 interventions that address surveillance, cause of death, vital registration, how to optimize routine health information systems, and how to seek financial investments and report data, as well as to use data to drive policy impact, enable use. So each of the letters, SCORE, stands for survey, CRVS, optimizing, review, as well as enable use. This year, about a month ago, we launched the first ever global assessment that was undertaken across these elements for about over 150 plus countries. And now we have the tools, we know where the gaps are. So the focus now is to see how we can utilize the lessons that we have learned through COVID and the response, as was mentioned, using mobile technology, geospatial. How do we accelerate improving surveillance systems? How can we accelerate death registrations and causes of death? And optimizing, how do we know where the healthcare facilities are? Are they close to where population density is? And we have a lot of lessons to learn, and GIS cuts across all of these elements of the SCORE technical package. What we have learned with the polio eradication in Africa, for example, that GIS was extremely instrumental to reach the most difficult, the last mile, as you may call it. So I think this is the way we are moving now. We have about just less than 10 years to reach the sustainable development goals that all countries, including the United States, have acknowledged. The question is, should we be working towards improving over the next 10 years the data systems, or rather focus on getting back on track, because we have lost a lot of progress that was made due to COVID, but also to accelerate progress and save lives, improve health. It's not just about longevity, but it's about quality of life as well. So I think acceleration really can happen only when we bring the confluence of technology with partnerships, because one agency, WHO, cannot do it alone. So we are moving and embracing both technology and partnership. So we look forward to all the lessons that United States have learned and the progress that has been made. So please share with us and enrich so that we can scale the lessons rapidly to other countries as best practices.
Very well said. I think acceleration is, of course, a key need. And I love how you pointed out that it's kind of across the board, that nobody is immune to challenges with dealing with health information in this crisis. So it seems that COVID has been the great leveler when it comes to health information and managing it and cleaning it and making sure that it's usable and current. So thank you for that. I'm going to move to Dr. Jarman. Rome, and so everybody knows Rome is an application. It's a great example of an application that could be leveraged by any agency that's interested in targeting hard to reach populations. Very relevant to right now is the ability to effectively act locally. So how did Rome help you achieve that?
So thanks, Esri. That's a great question. So Rome was a tool that we built so that we could more nimbly use information from what we called our planning database, which was sort of a that looks at areas of the country where we've traditionally had a difficult time getting responses to the census and our other surveys. And so it compiled a bunch of information from all those surveys. But then with Rome, we put it on a map. And not only could you put it on a map, you could layer then other information on top of that. So one of the things that we do with the census is we partner with hundreds of thousands of state and local organizations across the country to try to promote the census and encourage folks to get out and count. So with that, you can use tools like figure out, is there a church in the neighborhood where we can do training? Is there other resources in the area that we might partner with to encourage response? And so it was just hugely valuable as we were preparing for the census and working on our plans and getting partners to help us. It was a common language that everybody could speak. They could look at the same map and understand the same information, and really sort of put in context what happens in very local communities. But then, like I was mentioning before, that same information, that same sort of ability to layer new things on top was very helpful for us. And so seeing where some of the disasters and what have you that happened during the period where we have door knockers out, getting responses from people, we were able to use that same kind of local information that's in Rome to sort of understand how we could work the cases in those areas more efficiently, and to put tools in the hands of our regional census offices and the enumerators, so they could go out there and try to make sure that they were safe while they were doing their job, but they were also likely to be successful because they knew that this area was not impacted, and they'll come back to the impacted area next week. Sometimes maybe poor Louisiana, they kept getting hit by more and more hurricanes. But I think that that sort of granular level information that's both timely and accurate really helped us succeed in getting a complete count this year. So.
Well, I don't know if you know, Dr. Jarman, but Rome has influenced us at Esri. Some very bright people at Esri have looked at what you've done and modeled it and turned it around to see if that kind of approach can really support vaccine confidence in communities and acting locally in that way. So thank you for the inspiration, much appreciated. For Dan, I want to ask you a question. The VHA has a very clear mission: honor America's veterans by providing exceptional healthcare that improves their health and well-being. My understanding is that you have a real vision for GIS and its potential to support that mission. So can you talk about where you see GIS giving the greatest impact in the future at VHA, and what are some of the key building blocks to get there?
Thanks, Esty. Well, that mission we have a phenomenal mission, in highlighting the staff, what they've gone through during this past year. GIS can help them. So the greatest impact that I see GIS in the future is our delivery of that healthcare to provide the best care to the veterans. And what I did, some of the building blocks, is being in the strategy office and being primarily a healthcare administrator. And before I got here, I couldn't even spell GIS. So I spent my career without these tools at the hospital level. So once I started seeing the power of GIS, especially as we started unveiling it during this pandemic, to improve the insight that we were gaining and the decision-making that it brought to enhance the decision-making, I really became a believer in it. So the first step was looking at internally in our Veterans Health Administration, getting a strategy together with our Geospatial Service Support Center. And we moved forward working with Esri to get our first enterprise agreement that spans from the field level all the way up to the strategic level. So my main vision was giving these tools and the training that comes with it to the workforce, that spatial workforce, because I know at the facility level, it's an additional duty. So I want to make it easy. I never had these tools growing up in the hospital. So we managed to get an enterprise agreement where now we have the capability from the strategic level to integrate at the operational level, all the way down to all 170 VA medical centers. And so we're unrolling that. And after that, at the VA level, I've been asked to be the co-chair of a geospatial subgroup where I'm working on the infrastructure, the GIS infrastructure for the entire VA. So I took what I learned at the VHA, and I've been looking at it from a global enterprise level from the entire VA and also the federal level. So I've taken a look at, we've modeled it off of doing the deep dive into the Geospatial Data Act of 2018, where they have those 13 responsibilities of an agency, making sure we're anchored into the law. And then we've done the crosswalks with the National Spatial Data Infrastructure, looking at their guiding principles, their goals, their objectives, and their anticipated outcomes. And then we integrated with the VA and incorporated GIS into their VA data strategy. And out of that VA data strategy, we've got our subspatial goals and objectives already. And where we are right now is looking at it's not just infrastructure, it's more of an architecture. So we're marrying it up with the whole enterprise architecture, looking at those domains where we've hit the strategic. Now we're looking into the business aspects of it, the data aspects of it, the infrastructure, and the security of it. So I see it very powerful. Once we get it integrated, we can leverage the power of GIS from the bottom, at the tactical level where the patients are and the staff are, and integrate it with the other Veterans Benefits Administration, the National Cemetery Administration, leverage the power of the VA, and then expand it now that we're aligned with the National Spatial Data Infrastructure Strategic Plan to integrate better with the outside agencies.
Wow, I find what you're doing absolutely stunning. And I know we've spoken before, and for the audience, I think that Dan and I have sort of this similar history about GIS, that we saw it and one day and light turns on and it's like a go and a movement forward. And just your ability to execute and move it at the pace that you have done is amazing. So great work there. I mean, I wish everybody could execute like that. It's incredible. And I love that you mentioned the Geospatial Data Act and the compliance and adherence to that. I think that's awesome. So Rob, my next question is for you, and in your own words, and based on COVID-19, and of course, looking ahead, how do we really build the system that people expect in order to fully support future response? And of course, where does GIS fit in that system?
Of course, so thank you. It's an excellent question. To know where we're going, we kind of have to know where we were. Pre-COVID, we had dashboards, we had story maps, we had data streams coming in from lots of different sources, and we had I'm going to call them our bread and butter kind of things. We knew about hurricanes, we know about all these natural disasters. So we had been able to ramp up and then slim down. So we've had that ability to get authoritative data, to kind of parse through what's not authoritative, what's authoritative, and figure that out. What we didn't realize was how big COVID was going to get, and what that was going to cause to our system, to our staff, and then to our users. So pre-COVID, we were looking at about at a peak no more than 2,000 users. And at a peak, no more than 500,000 hits per week to our common operating picture, whether it's our steady state one, which is the only one we had at the time, or others. So we were comfortable with that level of interaction between our users. COVID starts to ramp up mid 2020. We start to really hit that high point. We start talking about data elements that we've never seen, getting ventilators. How many? I mean, we were talking about individual ventilators at every single hospital facility in the nation. Hospitals are not required to report to HHS up front. They just don't. We get it aggregated, but we don't get it down to the individual. And we were requiring that level of granularity from all of those facilities. So getting that information and getting at that level of detail and keeping that level of detail and allowing our users to now be able to look at that level of granularity from the beginning of time through now. Okay, so you're in the present, and that kind of a database we had not yet ever built nor managed. So we started to see that. We were tracking, I mean, we normally don't track deaths. That just doesn't normally happen. There are some events that we do. There are wildfires that do cause deaths, but you're really only talking about maybe one county being overwhelmed. We send a mortuary team. You send, so you're sending one mortuary team. You're sending one or two teams. We're not literally sending everyone out the door we can possibly send. And then 2 months later, we're going to send you out the door again because we just don't have enough people. So tracking people, our own staff, became incredibly difficult for us because when you start, we started getting questions about how many people were deployed. Well, individual or teams, and we normally track by team, but now they're wanting individuals. Now we're tracking, like we talked about earlier, we're tracking vaccine. Again, that's not generally our normal business line, but it is now. So in the peak of all of this, we kind of looked back at our system to say, all right, our system, it had its issues, it grew, it crashed, it grew some more, it crashed, and it kept growing and then crashing, but we kept, sort of reconstituting it and getting it back to fully functional system. What we realized was we got to a point where we had, from the 2,000 users, we were now at 5,000 users. Within a year, we're more than double. But even more so, we went from 500,000 hits per week to almost 1 million hits per day. We were just about at between 5 and 6 million hits a week. So the data that we had was being consumed so often that it was literally taxing our system and creating bottlenecks within the HHS network and everywhere else. So luckily, and this is the part sort of looking forward, we had already been in talks about migrating our system to the cloud and having our cloud being a more agile system and expandable in the cloud. That we had already seen was the future. We already were planning on going there. So it was already in the works for 2021. So that's where we're going this year, is we are moving our whole geospatial system up to the cloud. It will no longer be part of, or on, I should say, an HHS network. It'll be connected to it. We'll have the ability to pull that data, but we're gonna go to a cloud-based system. We're still gonna have to do what we normally do. So we're still gonna be doing hurricanes, earthquakes, tornadoes, wildfires. That will never stop. But now what's happened is, for example, the wildfires last year, or I'd say 2 years ago, wildfires was just evacuations, and we moved them into mass shelters. And there's 300 people in a shelter, and after the fire, they get moved back. You don't move 300 people into one shelter anymore. It's too close. There are too many people. So now it's how many people are you moving, and what's the COVID count in that county? Where are the shelters? And now you're not just opening one shelter, you're opening half a dozen or a dozen shelters because you got to keep these people separate. And then there's the PPE that has to be delivered. And then there's the vaccines that are now going to get delivered. So it is an exponential equation for what we do in the past and now where we have to go in the future. Every single map that we make honestly has something to do with COVID, even if you don't think it is. State of the Union or the inauguration was all about COVID and how close people can get in, with the COVID. We have, upcoming upcoming planned events. We still don't know what's going to go on for State of the Union. We still don't know what's going to go on for 4th of July. These are things we normally would know. I could normally make you a map 6 months ahead of time about where we're going to put teams for the 4th of July, make some changes, and we're done. I have no clue. Everything is brand new this year. Everything has changed. So the ability for us to surge, the ability for us to coordinate with all of our federal partners and our state partners and our local partners has grown just because of COVID and what we've had to do. So we've changed how we do things. We've changed our business process, but we've grown and matured along the way.
I think that's awesome. And I had another question prepared for all of you, but we have some good audience questions and a few minutes left. So let me get to some audience questions. I'm going to pose the first one for Dan, but I'll invite the others to jump in, maybe for some sort of rapid fire responses. So the question posed is, what is most important for leaders in agencies to understand about GIS to ensure that it's seen as critical?
I think that's a great question. It's the power of GIS. It's getting those spatial layers. So in the healthcare, what's been absent is the ability to visualize, say, the facility level data with the patient level data. Then you get into the health equity level data, population health data. You start going down the road, and you can only do that really through GIS effectively. And the tools exist to do that right now. That's why I'm a firm believer in that. And then looking at it from we are in the government, but we're into the stewardship of the money. So we are limited on resources. So GIS helps us with the business side and looking at how you merge that public health and the delivery care system together. And GIS is a phenomenal way of doing that. We all see it a little, but I think it comes down to the people, making sure the people have the training. You don't have to be an expert in it, but you should still have some oversight of what spatial analytics is. So we're setting up, at least in the VHA, that focusing on getting a federated spatial workforce to send the message out at every level, from the facility level, operational level, up to the strategic level. I hope that answers the question.
Thank you. Did anybody else want to comment? Ron?
So Esty, I would just say that, geography is the sort of the common denominator of most of the data sets. If there's something that interests humans, it's probably got some sort of geographic aspect to it. And so, when you're thinking about mashing up different sources of data, geography is often the thing that you're doing it on. And then if you tie geography and time together and get some nice spatial temporal aspects to it, you really have a powerful sort of tool for understanding how things work and making better decisions. So I would just say that the notion that geography is the kind of the glue that holds all this together. And that drives a lot of our thinking at the Census Bureau is how can we bring things together in sort of a geospatial aspect. And so, that just, it makes everything else easy once you sort of admit that that's the case. So.
Quick question for everybody. We'll go through one sentence or less if you can. How do we keep this sense of urgency to improve our systems? That's a hard one to do in one or less. It's a challenge.
I can go ahead. Today is an important landmark because the first round of COVID vaccine has been rolled out in Ghana today through the Global COVAX facility, co-led by WHO, Gavi, and CEPI. Going forward, GIS technology will help countries with vaccination planning, distribution, and monitoring. Just the layering of time and space, given how we have to deploy the vaccination precisely and within the time and space. So GIS is definitely integral for us to be efficient and be better stewards of the resources and the opportunities we have to save lives and improve public health.
I can't imagine a better ending statement than that. So thank you, Dr. Asma. I actually honestly hate to have to wrap this discussion. I could talk to you guys for ages, but our time is coming to an end. And I think we've covered so much in the last hour that is inspiring not only to me, but I'm sure to our viewers. Through this conversation, I've heard very clearly that the federal government can absolutely be agile and inventive, that the WHO can rally to support member states no matter their level of resources. We've all heard you share the ways that GIS adds value to your work and will expand its importance as we go forward. So I hope everybody feels inspired by the strategy and the tactics that this great panel of leaders has articulated. I think it makes the way forward seem actually quite tangible. So let me sincerely thank all of our panelists. Thank you, ladies and gentlemen, for your time today, and especially thanks to all of you for your leadership and the work that you've done, the efforts that you've put in and your teams have put in for fighting COVID-19 and advancing the work of governments across the board. And really for sharing a compelling vision for GIS and how it supports all of your individual missions that mean so much to the rest of us as residents, part of the global community. And I also want to thank our viewing audience. Thank you so much for joining us today. Have a great one.